Question 1. A 72-year-old client with a history of hypertension, type 2 diabetes mellitus, and chronic kidney disease stage 3 is admitted for worsening lower extremity edema and fatigue. The nurse reviews the laboratory results and notes that the serum creatinine has increased from 1.2 milligrams per deciliter 6 months ago to 2.0 milligrams per deciliter today. The blood urea nitrogen, BUN, is 32 milligrams per deciliter, urine output is 40 milliliters per hour, and vital signs are stable. The client asks why the healthcare provider is concerned because the creatinine value doesn't seem very high. Which nursing response is most accurate? A. The creatinine value is only important when it exceeds 5 milligrams per deciliter. B. A rise in creatinine from baseline often indicates worsening kidney function even if the number does not appear extremely elevated. C. Creatinine levels are not useful in evaluating kidney function. D. Only urine output determines whether kidney function is worsening. Answer. B. A rise in creatinine from baseline often indicates worsening kidney function even if the number does not appear extremely elevated. Rationale. Trends are often more important than a single creatinine value. A rise from 1.2 to 2.0 milligrams per deciliter represents a significant decline in kidney function and requires evaluation. Question 2. A client admitted with severe dehydration after several days of vomiting has a serum creatinine level of 1.9 milligrams per deciliter. The nurse compares this value to a previous level of 0.8 milligrams per deciliter obtained 1 month earlier. Which interpretation is most appropriate? A. The elevated creatinine may reflect acute kidney injury related to decreased renal perfusion. B. The creatinine level is unrelated to hydration status. C. The elevated creatinine confirms end-stage renal disease. D. The value indicates liver failure. Answer. A. The elevated creatinine may reflect acute kidney injury related to decreased renal perfusion. Rationale. Severe dehydration reduces renal blood flow, causing prerenal acute kidney injury and an increase in serum creatinine. Question 3. A nurse is caring for a hospitalized client receiving intravenous gentamicin therapy for sepsis. The morning laboratory results reveal that serum creatinine has increased from 0.9 milligrams per deciliter to 1.5 milligrams per deciliter over 48 hours. Which action should the nurse take first? A. Document the finding as expected. B. Encourage oral fluids only. C. Notify the healthcare provider of the change. D. Restrict fluid intake. Answer. C. Notify the healthcare provider of the change. Rationale. Aminoglycosides are nephrotoxic. An acute rise in creatinine may indicate drug-induced kidney injury requiring prompt intervention. Question 4. A client with advanced muscle wasting due to long-term immobility has a serum creatinine level of 0.4 milligrams per deciliter. Which interpretation by the nurse is most accurate? A. Kidney function is definitely normal. B. Kidney function is likely above average. C. Low muscle mass may falsely lower creatinine values. D. The client is experiencing kidney failure. Answer. C. Low muscle mass may falsely lower creatinine values. Rationale. Creatinine is produced from muscle metabolism. Clients with reduced muscle mass may have deceptively low serum creatinine levels despite impaired kidney function. Question 5. A nurse assesses a client admitted with rhabdomyolysis after a crush injury. Which laboratory trend would most strongly suggest worsening kidney injury? A. Creatinine increasing from 1 milligrams per deciliter to 2.8 milligrams per deciliter. B. Sodium increasing from 136 milliequivalent/L to 138 milliequivalent/L. C. Calcium increasing from 9.0 milligrams per deciliter to 9.1 milligrams per deciliter. D. Hemoglobin increasing from 13 g/dl to 13.2 g/dl. Answer. A. Creatinine increasing from 1 milligrams per deciliter to 2.8 milligrams per deciliter. Rationale. Rhabdomyolysis can cause acute tubular necrosis. Rising creatinine is a major indicator of worsening renal injury. Question 6. A nurse is reviewing laboratory data for 4 clients. Which client should be assessed first? A. Creatinine 1 mg per deciliter with stable urine output. B. Creatinine 0.8 mg per deciliter after hydration therapy. C. Creatinine 2.5 mg per deciliter with rapidly declining urine output. D. Creatinine 1.1 mg per deciliter after surgery. Answer. C. Creatinine 2.5 mg per deciliter with rapidly declining urine output. Rationale: elevated creatinine combined with oliguria suggests significant deterioration in renal function and requires immediate assessment. Question 7. A client with heart failure receives aggressive diuretic therapy. 2 days later, the serum creatinine rises from 1.1 mg per deciliter to 1.8 mg per deciliter. Which explanation best accounts for this finding? A. Reduced kidney perfusion from excessive fluid removal. B. Increased liver metabolism. C. Improved cardiac output. D. Increased red blood cell production. Answer. A. Reduced kidney perfusion from excessive fluid removal. Rationale: excessive diuresis can decrease intravascular volume, reducing renal perfusion and causing creatinine elevation. Question 8. A client asks why creatinine is considered a more reliable indicator of kidney function than BUN. Which response by the nurse is best? A. Creatinine is less affected by diet and hydration status. B. Creatinine is produced by the liver. C. Creatinine measures electrolyte levels. D. Creatinine is unrelated to kidney function. Answer. A. Creatinine is less affected by diet and hydration status. Rationale: creatinine is generally a more specific marker of renal filtration than BUN, which can be influenced by numerous non-renal factors. Question 9. A client with septic shock develops a serum creatinine increase from 0.7 mg per deciliter to 1.4 mg per deciliter within 24 hours. Which interpretation is most accurate? A. Kidney function has doubled. B. The rise is insignificant. C. The increase may meet criteria for acute kidney injury. D. Dialysis is no longer necessary. Answer. C. The increase may meet criteria for acute kidney injury. Rationale: even seemingly small increases in creatinine can represent substantial reductions in glomerular filtration rate and may indicate AKI. Question 10. A nurse caring for a client with chronic kidney disease notes a creatinine level of 4.5 mg per deciliter. The client states, "My creatinine was 4.4 mg per deciliter last month." Which interpretation is most appropriate? A. Kidney function is rapidly worsening. B. The value should be interpreted in comparison with previous trends. C. Immediate dialysis is always required. D. The value is unrelated to kidney disease. Answer. B. The value should be interpreted in comparison with previous trends. Rationale: trend analysis is essential. A relatively stable creatinine may indicate chronic disease rather than an acute decline. Question 11. A nurse is caring for a 68-year-old client admitted with community-acquired pneumonia. Upon admission, the serum creatinine level was 0.9 mg per deciliter. 48 hours later, the creatinine level is 1.4 mg per deciliter, urine output has decreased to 25 milliliters per hour, and the client has developed mild peripheral edema. The nurse notes that the provider has not yet reviewed the laboratory results. Which action is the nurse's priority? A. Continue monitoring because the creatinine remains within a moderately acceptable range. B. Encourage the client to increase oral protein intake. C. Notify the healthcare provider immediately of the changing renal status. D. Restrict sodium intake and reassess in 24 hours. Answer. C. Notify the healthcare provider immediately of the changing renal status. Rationale: an increase in creatinine from baseline combined with declining urine output may indicate acute kidney injury. Early intervention is critical to prevent further renal damage. Question 12. A nurse reviews laboratory results for a client who recently underwent a contrast-enhanced CT scan. The client's creatinine level increased from 1 mg per deciliter before the procedure to 2.1 mg per deciliter 72 hours later. Which finding best supports the suspicion of contrast-induced nephropathy? A. Increased appetite. B. Elevated urine output. C. Recent exposure to intravenous contrast material followed by creatinine elevation. D. Mild improvement in blood pressure. Answer. C. Recent exposure to intravenous contrast material followed by creatinine elevation. Rationale. Contrast-induced nephropathy typically presents as an increase in serum creatinine occurring within a few days after contrast exposure. Question 13. A client with long-standing hypertension presents for routine follow-up. Laboratory results reveal a serum creatinine of 1.8 milligrams per deciliter compared with 1.7 milligrams per deciliter 3 months ago and 1.6 milligrams per deciliter 6 months ago. Which interpretation is most accurate? A. The client has acute kidney injury. B. The trend suggests gradual progression of chronic kidney disease. C. The kidneys are improving. D. The values are unrelated to hypertension. Answer. B. The trend suggests gradual progression of chronic kidney disease. Rationale. A slowly rising creatinine over months commonly reflects progressive chronic kidney disease rather than an acute event. Question 14. A critically ill client in the intensive care unit develops oliguria. The serum creatinine is currently 1 milligrams per deciliter. The nurse understands which principle regarding creatinine interpretation? A. Normal creatinine excludes kidney injury. B. Creatinine may remain normal during the early stages of acute kidney injury. C. Creatinine rises before kidney damage occurs. D. Oliguria is unrelated to renal function. Answer. B. Creatinine may remain normal during the early stages of acute kidney injury. Rationale. Serum creatinine often lags behind actual kidney injury. Significant renal damage may occur before laboratory elevation becomes evident. Question 15. A nurse is evaluating a bodybuilder admitted with dehydration after participating in a strenuous competition. The client's serum creatinine is 1.7 milligrams per deciliter. Which factor may partially explain the elevated creatinine? A. Increased muscle mass and muscle metabolism. B. Reduced skeletal muscle stores. C. Severe liver dysfunction. D. Hyperthyroidism. Answer. A. Increased muscle mass and muscle metabolism. Rationale. Individuals with substantial muscle mass may naturally produce more creatinine than average, leading to higher baseline values. Question 16. A nurse is reviewing laboratory values for an older adult residing in a long-term care facility. The client's serum creatinine is 1 milligrams per deciliter. The nurse recognizes which important consideration? A. The value always indicates excellent kidney function. B. Elderly clients may have reduced kidney function despite normal creatinine levels. C. Creatinine becomes irrelevant after age 65. D. Normal creatinine confirms adequate glomerular filtration. Answer. B. Elderly clients may have reduced kidney function despite normal creatinine levels. Rationale. Aging is associated with reduced muscle mass, which can mask renal impairment by producing lower creatinine levels. Question 17. A client with acute kidney injury has a creatinine level of 3.6 milligrams per deciliter. During assessment, which finding would most concern the nurse? A. Blood pressure of 168/96 mmHg. B. Potassium level of 6.4 milliequivalent/L. C. Mild fatigue. D. Decreased appetite. Answer. B. Potassium level of 6.4 milliequivalent/L. Rationale. Hyperkalemia is a life-threatening complication of kidney dysfunction and requires immediate intervention because of the risk of fatal dysrhythmias. Question 18. A nurse is caring for a client receiving vancomycin therapy for methicillin-resistant bacterial infection. Which laboratory trend would require the most immediate follow-up? A. Creatinine increasing from 0.8 milligrams per deciliter to 1.6 milligrams per deciliter. B. Sodium increasing from 137 milliequivalent/L to 138 milliequivalent/L. C. Hemoglobin increasing from 12.5 g/dl to 12.8 g/dl. D. Platelet count increasing from 210,000/mm superscript 3 to 215,000/mm superscript 3. Answer. A. creatinine increasing from 0.8 milligrams per deciliter to 1.6 milligrams per deciliter. Rationale: vancomycin can be nephrotoxic. A doubling of creatinine suggests significant deterioration in renal function. Question 19. A client with severe heart failure is hospitalized for fluid overload. After aggressive treatment, the nurse notes that the client's edema has improved, but creatinine has risen from 1.2 milligrams per deciliter to 2.0 milligrams per deciliter. Which interpretation is most appropriate? A. Improved edema always indicates improved kidney function. B. Renal perfusion may have decreased despite successful fluid removal. C. The creatinine value is likely inaccurate. D. Kidney function and fluid status are unrelated. Answer: B. Renal perfusion may have decreased despite successful fluid removal. Rationale: aggressive fluid removal can improve edema while simultaneously reducing renal blood flow, resulting in worsening kidney function. Question 20. A nurse is teaching a newly hired graduate nurse about creatinine interpretation. Which statement by the graduate nurse indicates correct understanding? A. Only extremely elevated creatinine levels are clinically significant. B. Creatinine values should always be interpreted alongside baseline levels, urine output, and clinical findings. C. A normal creatinine always rules out kidney disease. D. Creatinine is more useful than assessment findings. Answer: B. Creatinine values should always be interpreted alongside baseline levels, urine output, and clinical findings. Rationale: creatinine must be evaluated in the context of trends, baseline values, urine output, patient history, medications, and overall clinical status. Question 21. A 64-year-old client with chronic kidney disease stage 4 is admitted with shortness of breath and generalized weakness. The nurse reviews laboratory results and notes that the serum creatinine has increased from 3.8 milligrams per deciliter 1 month ago to 5.2 milligrams per deciliter today. The client reports decreased urine output over the past week. Which assessment finding should the nurse identify as the highest priority? A. Dry skin on the lower extremities. B. Crackles heard bilaterally in the lung bases. C. Mild nausea after meals. D. Decreased appetite. Answer: B. Crackles heard bilaterally in the lung bases. Rationale: rising creatinine with decreasing urine output increases the risk of fluid overload. Pulmonary edema can rapidly become life-threatening and requires immediate intervention. Question 22. A client recovering from major abdominal surgery has a serum creatinine level that increased from 0.9 milligrams per deciliter preoperatively to 1.5 milligrams per deciliter on postoperative day 2. Urine output has averaged 28 milliliters per hour over the last 8 hours. Which nursing interpretation is most appropriate? A. These findings are expected after all surgical procedures. B. The client may be developing postoperative acute kidney injury. C. The creatinine level remains normal and requires no action. D. The findings suggest improved renal function. Answer: B. The client may be developing postoperative acute kidney injury. Rationale: rising creatinine and reduced urine output following surgery may indicate AKI secondary to hypotension, blood loss, nephrotoxic exposure, or decreased renal perfusion. Question 23. A nurse is caring for a client with septic shock receiving vasopressor therapy. The serum creatinine level has risen from 1.1 milligrams per deciliter to 2.3 milligrams per deciliter over 36 hours. Which pathophysiological mechanism most likely contributed to the elevation? A. Increased renal blood flow. B. Decreased renal perfusion resulting in impaired filtration. C. Increased liver enzyme production. D. Excessive creatinine excretion. Answer: B. Decreased renal perfusion resulting in impaired filtration. Rationale: septic shock commonly reduces effective kidney perfusion, leading to impaired glomerular filtration and elevated serum creatinine. Question 24. A client with diabetic nephropathy asks why the healthcare provider frequently orders estimated glomerular filtration rate, eGFR, along with creatinine levels. Which response by the nurse is best? A. eGFR provides a better estimate of overall kidney filtration capacity. B. eGFR measures liver function. C. eGFR replaces all other kidney tests. D. Creatinine and eGFR evaluate unrelated systems. Answer. A. eGFR provides a better estimate of overall kidney filtration capacity. Rationale. eGFR incorporates creatinine and patient-specific variables to estimate kidney filtration function more accurately than creatinine alone. Question 25. A nurse is reviewing laboratory trends for a client admitted with severe burns. The serum creatinine was 0.8 milligrams per deciliter upon admission and is now 1.6 milligrams per deciliter. Which conclusion is most appropriate? A. Kidney function has likely improved. B. The change may indicate developing acute kidney injury. C. The increase is clinically insignificant. D. Burn injuries do not affect renal function. Answer. B. The change may indicate developing acute kidney injury. Rationale. Burn injuries can cause hypovolemia, tissue destruction, and renal hypoperfusion, increasing the risk for AKI. Question 26. A nurse receives report on 4 clients. Which client should be assessed first? A. A client whose creatinine decreased from 2.2 milligrams per deciliter to 1.8 milligrams per deciliter. B. A client with stable chronic kidney disease and creatinine of 3.5 milligrams per deciliter. C. A client whose creatinine increased from 0.7 milligrams per deciliter to 1.3 milligrams per deciliter within 24 hours and who reports reduced urine output. D. A client with a creatinine of 1 milligrams per deciliter and stable vital signs. Answer. C. A client whose creatinine increased from 0.7 milligrams per deciliter to 1.3 milligrams per deciliter within 24 hours and who reports reduced urine output. Rationale. A rapid increase in creatinine and declining urine output suggest acute kidney injury and require prompt assessment. Question 27. A client with chronic kidney disease asks why serum creatinine sometimes rises even though symptoms have not changed. Which explanation by the nurse is most accurate? A. Kidney function can worsen before noticeable symptoms develop. B. Symptoms always appear before laboratory changes. C. Creatinine levels are unrelated to kidney function. D. Symptoms are more reliable than laboratory testing. Answer. A. Kidney function can worsen before noticeable symptoms develop. Rationale. Significant declines in renal function can occur before symptoms become clinically apparent. Question 28. A nurse is assessing a client with a creatinine level of 6.8 milligrams per deciliter. Which additional finding would most strongly suggest severe uremia? A. Persistent confusion and altered mental status. B. Mild seasonal allergies. C. Dry eyes. D. Muscle soreness after exercise. Answer. A. Persistent confusion and altered mental status. Rationale. Severe elevations in creatinine may accompany uremia, which can cause neurologic manifestations including confusion, lethargy, and altered mental status. Question 29. A client admitted with urinary retention caused by benign prostatic enlargement has a serum creatinine level of 2.9 milligrams per deciliter. Which mechanism best explains the elevated creatinine? A. Postrenal obstruction reducing glomerular filtration. B. Increased muscle production of creatinine. C. Enhanced kidney filtration. D. Increased gastrointestinal absorption. Answer. A. Postrenal obstruction reducing glomerular filtration. Rationale. Urinary tract obstruction can increase pressure within the urinary system, impair filtration, and elevate serum creatinine. Question 30. A nurse caring for a client with worsening kidney function reviews the following data. Creatinine increased from 2.1 milligrams per deciliter to 3.4 milligrams per deciliter. Urine output decreased from 45 milliliters per hour to 15 milliliters per hour. Potassium increased from 4.8 milliequivalent/L to 6.1 milliequivalent/L. Weight increased by 3 kilograms in 48 hours. Which finding requires the most immediate intervention? A. Weight gain of 3 kilograms. B. Rising creatinine level. C. Potassium level of 6.1 milliequivalent/L. D. Reduced urine output. Answer. C. Potassium level of 6.1 milliequivalent/L. Rationale. Although all findings indicate worsening renal function, Severe hyperkalemia presents the most immediate threat because it can precipitate life-threatening cardiac dysrhythmias. Question 31. A 58-year-old client with poorly controlled type 2 diabetes mellitus is admitted for evaluation of progressive fatigue and lower extremity swelling. The nurse reviews laboratory results and notes that the serum creatinine has increased from 1.3 milligrams per deciliter 1 year ago to 2.8 milligrams per deciliter today. The client asks why the healthcare team is concerned since the increase occurred gradually. Which response by the nurse is most appropriate? A. Gradual increases in creatinine can indicate progressive loss of kidney function over time. B. Only sudden increases in creatinine are significant. C. Creatinine levels are unrelated to diabetic kidney disease. D. Kidney damage occurs only when creatinine exceeds 10 milligrams per deciliter. Answer. A. Gradual increases in creatinine can indicate progressive loss of kidney function over time. Rationale. Chronic increases in creatinine often reflect progressive nephron loss and worsening chronic kidney disease, especially in clients with diabetes. Question 32. A nurse is caring for a client receiving high-dose nonsteroidal anti-inflammatory drug, NSAID, therapy for chronic pain. The serum creatinine level has increased from 0.9 milligrams per deciliter to 1.7 milligrams per deciliter over several days. Which nursing action is most appropriate? A. Document the finding as expected. B. Notify the healthcare provider and review nephrotoxic medication use. C. Encourage unrestricted protein intake. D. Restrict fluid intake immediately. Answer. B. Notify the healthcare provider and review nephrotoxic medication use. Rationale. NSAIDs can reduce renal blood flow and contribute to acute kidney injury. Rising creatinine warrants prompt evaluation. Question 33. A client with chronic kidney disease presents with a creatinine level of 4.9 milligrams per deciliter. Which assessment finding most strongly suggests worsening fluid overload secondary to declining renal function? A. Weight gain of 4 kilograms over 5 days. B. Dry mucous membranes. C. Heart rate of 72 beats/min. D. Increased appetite. Answer. A. Weight gain of 4 kilograms over 5 days. Rationale. Rapid weight gain in kidney disease often reflects fluid retention resulting from reduced renal excretion. Question 34. A nurse is teaching a student nurse about creatinine values. Which statement by the student nurse requires correction? A. A normal creatinine does not always exclude kidney disease. B. Creatinine trends are often more important than a single value. C. A doubling of serum creatinine may represent a substantial decline in kidney function. D. Creatinine levels should always be interpreted without considering urine output. Answer. D. Creatinine levels should always be interpreted without considering urine output. Rationale. Creatinine must be interpreted alongside urine output, clinical status, medications, and laboratory trends. Question 35. A client is admitted with severe gastroenteritis and dehydration. The nurse notes a creatinine increase from 0.8 milligrams per deciliter to 1.6 milligrams per deciliter. Following aggressive intravenous fluid replacement, the creatinine decreases to 1 milligrams per deciliter. Which interpretation is most appropriate? A. The client likely experienced prerenal acute kidney injury related to volume depletion. B. The client has irreversible kidney failure. C. The creatinine change was unrelated to hydration status. D. The kidneys were functioning normally throughout hospitalization. Answer. A. The client likely experienced prerenal acute kidney injury related to volume depletion. Rationale. Improvement in creatinine after fluid resuscitation supports a prerenal cause related to decreased renal perfusion. Question 36. A client with systemic lupus erythematosus develops worsening kidney involvement. Which laboratory trend would most strongly support declining renal function? A. Creatinine increasing from 0.9 milligrams per deciliter to 2.4 milligrams per deciliter. B. Hemoglobin increasing from 11G/DL to 12G/DL. C. Sodium increasing from 138 milliequivalent/L to 139 milliequivalent/L. D. White blood cell count decreasing from 8,000/mm superscript 3 to 7,800/mm superscript 3. Answer: A. Creatinine increasing from 0.9 milligrams per deciliter to 2.4 milligrams per deciliter. Rationale: lupus nephritis can impair glomerular filtration, resulting in rising serum creatinine levels. Question 37. A client with acute kidney injury is being monitored closely. Which finding would indicate the greatest improvement in renal function? A. Creatinine decreasing from 3.8 milligrams per deciliter to 2.6 milligrams per deciliter. B. Potassium increasing from 4.5 milliequivalent/L to 5.5 milliequivalent/L. C. Weight increasing by 2 kilograms. D. Urine output decreasing from 50 milliliters per hour to 20 milliliters per hour. Answer: A. Creatinine decreasing from 3.8 milligrams per deciliter to 2.6 milligrams per deciliter. Rationale: a declining creatinine level generally suggests improving glomerular filtration and renal recovery when correlated with clinical improvement. Question 38. A nurse is reviewing laboratory results for a client with severe sepsis. The serum creatinine is 2.9 milligrams per deciliter, BUN is 48 milligrams per deciliter, and urine output has fallen significantly. Which complication is the nurse most concerned about? A. Progressive acute kidney injury. B. Hyperthyroidism. C. Increased gastrointestinal motility. D. Enhanced hepatic metabolism. Answer: A. Progressive acute kidney injury. Rationale: elevated creatinine, elevated BUN, and oliguria strongly suggest worsening renal dysfunction. Question 39. A client undergoing evaluation for kidney disease asks why healthcare providers monitor creatinine repeatedly rather than relying on a single measurement. Which response is most accurate? A. Creatinine values are useful only when measured daily. B. Changes in creatinine over time help identify improvement, stability, or worsening kidney function. C. A single creatinine value always provides complete information. D. Repeated measurements are performed only for research purposes. Answer: B. Changes in creatinine over time help identify improvement, stability, or worsening kidney function. Rationale: trend analysis allows providers to recognize disease progression, recovery, or acute deterioration. Question 40. A nurse receives report on a client whose creatinine increased from 1.1 milligrams per deciliter to 2.7 milligrams per deciliter over 24 hours. Additional findings include oliguria, generalized edema, and a potassium level of 6.5 milliequivalent/L. Which prescription should the nurse anticipate as the highest priority? A. Immediate evaluation and treatment of hyperkalemia. B. Routine dietary teaching. C. Ambulation 3 times daily. D. Increased protein supplementation. Answer: A. Immediate evaluation and treatment of hyperkalemia. Rationale: hyperkalemia is the most urgent complication because it can cause fatal cardiac dysrhythmias. The elevated creatinine and oliguria indicate severe renal impairment, contributing to potassium retention. Question 41. A 74-year-old client with chronic kidney disease stage 4 is admitted with increasing fatigue, nausea, and decreased urine output. The nurse reviews the morning laboratory results and notes that the serum creatinine has increased from 4.8 milligrams per deciliter to 6.1 milligrams per deciliter over the past week. Additional findings include potassium 6.7 milliequivalent/L, heart rate 48 beats/min, and peak T waves on the cardiac monitor. Which action should the nurse take first? A. Administer the prescribed potassium-lowering treatment. B. Obtain a dietary history. C. Educate the client regarding dialysis. D. Recheck the creatinine level in 4 hours. Answer: A. Administer the prescribed potassium-lowering treatment. Rationale: although the rising creatinine indicates worsening kidney function, the immediate life-threatening problem is severe hyperkalemia with ECG changes. Preventing fatal dysrhythmias takes priority. Question 42. A client with septic shock has the following laboratory trends over 24 hours. Creatinine, 1 milligrams per deciliter, 2.1 milligrams per deciliter. Urine output, 50 milliliters per hour, 15 milliliters per hour. Lactate, 2.0 millimoles per liter, 5.4 millimoles per liter. Blood pressure, 88/54 millimeter of mercury despite fluid resuscitation. Which conclusion should the nurse make? A. The kidneys are functioning normally. B. The client is developing multi-organ dysfunction, including acute kidney injury. C. The creatinine increase is unrelated to the clinical condition. D. The elevated lactate suggests improved tissue perfusion. Answer. B. The client is developing multi-organ dysfunction, including acute kidney injury. Rationale: rising creatinine, worsening oliguria, persistent hypotension, and elevated lactate suggest progressive organ hypoperfusion and multi-organ dysfunction syndrome. Question 43. A nurse caring for a client with acute kidney injury notes a creatinine increase from 1.2 milligrams per deciliter to 2.4 milligrams per deciliter within 48 hours. Which additional assessment finding would most strongly support worsening renal function? A. Increased urine-specific gravity with normal output. B. Urine output of 12 milliliters per hour. C. Appetite improvement. D. Respiratory rate of 16 breaths/min. Answer. B. Urine output of 12 milliliters per hour. Rationale: severe oliguria accompanying a rapid rise in creatinine strongly suggests worsening renal failure. Question 44. A client with end-stage kidney disease receives hemodialysis 3 times weekly. Before dialysis, the creatinine level is 9.8 milligrams per deciliter. Which nursing interpretation is most appropriate? A. The creatinine level alone determines the need for dialysis. B. Elevated creatinine is expected in end-stage kidney disease and must be interpreted with the overall clinical picture. C. The value confirms acute kidney injury. D. The result indicates laboratory error. Answer. B. Elevated creatinine is expected in end-stage kidney disease and must be interpreted with the overall clinical picture. Rationale: clients with end-stage kidney disease often have markedly elevated creatinine levels. Treatment decisions depend on symptoms, electrolyte status, fluid balance, and overall clinical condition. Question 45. A nurse is reviewing the chart of a trauma client with severe rhabdomyolysis. Which trend requires the most immediate follow-up? A. Creatinine 1.1 milligrams per deciliter to 3.9 milligrams per deciliter. B. Hemoglobin 13.8 g/dl to 13.4 g/dl. C. Sodium 139 milliequivalent/L to 140 milliequivalent/L. D. Respiratory rate 18 breaths/min to 20 breaths/min. Answer. A. Creatinine 1.1 milligrams per deciliter to 3.9 milligrams per deciliter. Rationale: rhabdomyolysis can rapidly cause acute tubular necrosis. A dramatic increase in creatinine suggests significant kidney injury requiring urgent intervention. Question 46. A nurse is caring for a client with advanced heart failure receiving intravenous diuretics. Which finding most strongly suggests that treatment is beginning to compromise renal function? A. Improved peripheral edema. B. Weight loss of 2 kilograms. C. Creatinine increase from 1.3 milligrams per deciliter to 2.2 milligrams per deciliter. D. Reduced jugular venous distension. Answer. C. Creatinine increase from 1.3 milligrams per deciliter to 2.2 milligrams per deciliter. Rationale: aggressive diuresis can reduce renal perfusion. Rising creatinine is a key indicator of declining kidney function despite improvement in fluid overload. Question 47. A client with diabetic nephropathy is being evaluated during an outpatient visit. Which assessment finding, when combined with a steadily rising creatinine level, most strongly suggests progression of chronic kidney disease? A. Persistent proteinuria. B. Seasonal allergies. C. Mild muscle soreness. D. Occasional headaches relieved by rest. Answer. A. Persistent proteinuria. Rationale: proteinuria and rising creatinine are hallmark indicators of progressive diabetic kidney disease and worsening nephron damage. Question 48. A nurse is analyzing data from 4 hospitalized clients. Which client should be assessed first? A. Creatinine 1.6 milligrams per deciliter, stable urine output, no symptoms. B. Creatinine 2.4 milligrams per deciliter, blood pressure stable, mild fatigue. C. Creatinine 3.8 milligrams per deciliter, potassium 6.3 milliequivalent/L, ECG changes present. D. Creatinine 4.5 milligrams per deciliter, chronic dialysis client awaiting treatment. Answer. C. Creatinine 3.8 milligrams per deciliter, potassium 6.3 milliequivalent/L, ECG changes present. Rationale. Hyperkalemia with ECG changes represents the most immediate threat to life and requires urgent intervention. Question 49. A client recovering from acute kidney injury demonstrates the following trends over 3 days. Creatinine 4.2 milligrams per deciliter, 3.5 milligrams per deciliter, 2.8 milligrams per deciliter. Urine output 20 milliliters per hour, 45 milliliters per hour, 70 milliliters per hour. Potassium 5.8 milliequivalent/L, 4.9 milliequivalent/L, 4.3 milliequivalent/L. Which interpretation is most appropriate? A. The client is experiencing worsening renal failure. B. The client is showing evidence of renal recovery. C. The client requires immediate dialysis based solely on creatinine. D. The data are inconclusive. Answer. B. The client is showing evidence of renal recovery. Rationale: falling creatinine, improving urine output, and normalization of potassium levels collectively indicate improving kidney function. Question 50. A nurse in a critical care unit receives report on a client with rapidly worsening acute kidney injury. Assessment findings include creatinine increased from 1 milligrams per deciliter to 4.8 milligrams per deciliter in 72 hours. Urine output less than 10 milliliters per hour. Potassium 6.8 milliequivalent/L. Pulmonary crackles throughout both lung fields. Oxygen saturation 88% despite supplemental oxygen. New onset confusion. Using the Nclex priority framework, which nursing concern is highest priority? A. Rising creatinine indicating worsening renal filtration. B. New onset confusion indicating uremia. C. Pulmonary edema causing impaired oxygenation. D. Need for client education regarding kidney disease. Answer. C. Pulmonary edema causing impaired oxygenation. Rationale: while the severe creatinine elevation reflects profound kidney dysfunction, ABC priorities prevail. Pulmonary edema with hypoxemia threatens oxygenation and requires immediate intervention. The client is also at high risk for emergent dialysis due to fluid overload, hyperkalemia, and worsening uremia. Creatinine is one of the most misunderstood laboratory values on the Nclex. Many test takers focus only on whether the number is high or normal, but Nclex questions often test your ability to recognize trends, compare values with baseline measurements, identify acute kidney injury early, and prioritize life-threatening complications such as hyperkalemia, pulmonary edema, and severe oliguria. Remember these key Nclex principles. Trends are more important than a single creatinine value. A normal creatinine does not always mean normal kidney function. Small creatinine increases can represent significant declines in GFR. Always evaluate creatinine together with urine output, potassium, fluid status, and clinical presentation. In priority questions, treat ABC threats and hyperkalemia before focusing on the creatinine itself. Mastering creatinine interpretation will help you answer renal, cardiac, critical care, endocrine, pharmacology, and prioritization questions across the Nclex.